So I'm going to provide a little bit of education for you today on hypertension. You have some family history of some high blood pressure issues, and then you take some medications that are not for blood pressure, but they had noticed that you've had some high blood pressure readings in the clinic. So just wanted to kind of provide a little education for you, because hypertension is something that can be managed by patients at home, and then something that's very treatable to help prevent further health conditions. So here's some little information about hypertension that we'll kind of go through some of this, and then you can just have that handout to have at home. When it comes to managing blood pressure or trying to prevent high blood pressure, some of the things you can do are follow like a low sodium diet, so not adding salt to your foods or not adding excess salt, avoiding things that are really high in sodium, like sodas are pretty high in sodium, and then a lot of the sauces that we use, like even ketchup or steak sauce and stuff, have a lot of sodium in them, so just kind of limit the amount of those things that you eat. Also, exercise is good. Do you currently do any exercise? Or
occasionally.
Okay. So the goal is about 30 minutes a day of some cardio exercise, and that just helps kind of keep your heart healthy. So exercise every day with some walking, and then just make sure you're drinking plenty of fluids also. What about stress level? Do you feel like your stress is pretty high, or do you manage stress pretty well?
Only one to work.
Only one. Okay. So that's one thing to do to help keep your blood pressure down too, is try to avoid high stress situations, and find healthy ways to manage your stress. So whatever you consider to be a stress reliever for you, you want to find healthy ways to manage that stress. You don't smoke, and that's a good thing. Smoking does also increase your risk for high blood pressure. So checking your blood pressure at home is good, because in the clinic we check it once in a while, but keeping an eye on your blood pressure at home just helps you to see how that is doing. So if you will check it at home maybe once a day, once every couple of days, your goal is around 130 over 80 or lower. If you get to 140 over 90 where that's too high, we definitely want to make sure that you're not staying that way. So if you start seeing that at home your blood pressure is running higher than that 130 over 80 pretty consistently, you do want to make an appointment with your doctor to further discuss that. Anything else you might can do. Let's see. Some symptoms of hypertension, there really aren't a lot of symptoms. Most of the time that high blood pressure is called a silent killer, because you don't really know anything's going on with your body until it's too late. So typically the high blood pressure can lead into like increasing your risk for heart attack, for stroke. So those are some of the symptoms that we want you to be aware of, and be sure to follow up with somebody if you start having those symptoms. So symptoms of a heart attack, like chest pain, pressure, shortness of breath. If you're having a severe headache or any dizziness, you do want to let your provider know that also. And then of course symptoms of a stroke, if you start noticing that you're having some difficulty with speech, not able to communicate your words, if you notice that one side of your face is drooping, or you notice weakness on one side of your body, those are definitely things that you want to seek immediate treatment for. Signs of a stroke. And one of the other things, I think we talked about the exercise too, but just maintaining a healthy weight. So I think you had noted that you lost about 50 pounds in the last 6 months or so, which is great. And trying to keep your BMI at that closer to that healthy weight does lower your risk of the blood pressure problem. So trying to limit the foods in your diet, like I think you said you did like a keto diet kind of, so you're limiting a lot of carbs and things that can turn into that excess fat that we kind of hang on to. So that's good to also help manage your blood pressure issues and try to prevent hypertension in the future. Okay? Any questions?
None that I can think of.
Okay. Well, you've got this handout, so if you do have any further questions or concerns, you can reach out to your healthcare provider. Okay?
Sounds good.
All right. Thank you.